Thank you for joining us again today. In this episode, we're going to be discussing how do I know if I have cancer? What determines whether or not I have cancer? What is the ultimate decider?
Well, I've asked my patients over the years that exact question. How did you know that you had cancer? What made you go to a doctor in the first place? And almost all of those patients have said it was something that changed inside my body that was different to normal. That change might be a change in my bowel habits. It's different. It might be a change in the look of a mole that's been on my skin for a while and now it started just behaving differently. It might be pain that wasn't there before, perhaps a headache, perhaps an aching pain that won't go away, or a burning pain, or a stabbing pain. It's such an individual experience. But something has changed from what was previously. And the patient has gone to their healthcare provider, typically a doctor, to find out, what is this? What is this change all about? Is it something I should be frightened of? Because let's face it, all of us are scared of cancer. You don't want to get the diagnosis, but you do need to know very often.
So being self-aware is often very key to finding early diagnosis.
Absolutely, and that's why we encourage to do self-examinations, have a look at yourself, know what is normal, and be able to compare. So once at the doctor, typically the doctor would ask many questions because the doctor is trying to paint a picture of events, trying to better understand how these changes started occurring, when, the time span, how long it's taken, etc. So many questions later, and often certain investigations done as well, such as an X-ray, or perhaps a blood test, or a series of blood tests. We can include a urine test, is sometimes done, depending on where the problem is. From there, and all of those investigations, which very often turn out to be not as frightening an outcome as what we were worried about. Perhaps the outcome is good news by comparison to what it could be.
A simple bladder infection as opposed to cancer.
A simple bladder infection, or you've eaten something bad that has caused your stomach to run more or to be more constipated than normal, or a simple headache because you're stressed. The outcome can be very simple and not something that is bleak and dire and not necessarily cancer. Unfortunately, as we know, sometimes the news is bad, and the doctor cannot make a diagnosis of cancer based on those investigations. In order to make a diagnosis, a definitive diagnosis of cancer, you have to take a sample of the suspicious tissue. This is called a biopsy. So perhaps that biopsy is of the skin. Sometimes it's a little bit more difficult to get to. A sample of the lung tissue, for example. So sometimes that biopsy or that tissue sample can be taken under local anesthetic, but very often it involves an operation where you have to actually have general anesthetic. You sleep while the doctor is taking the sample tissue. That tissue sample is then taken to another specialist doctor, a pathologist, in a laboratory. The pathologist will look at the cells that he has received. He will compare these cells to what he knows to be normal, and hopefully the cells that he's looking at look like they should. In the event that they've started changing, that they've started behaving abnormally, when they've started growing abnormally, a diagnosis of cancer is often made at that point. I think the take-home message is that nagging feeling inside you that something is wrong, go and get it explored, go and get it investigated, because again, it's so much easier to treat cancer at a very early stage. Thanks for tuning in and watching our video. If you have any questions, comments, or even suggestions on what you'd like to see in future content, please leave them in the comment section below, and we'll get back to you as soon as we can. We're here to support you in your journey to learn more about cancer and how to manage it. Join our community and empower yourself with knowledge and resources to make informed decisions about your health.